Hello everyone, I'm Shweta, a podcast volunteer from Positive. Representing Positive, we are hosting our second episode in the podcast series. Lovely to have you here, sir, who has conferred a degree from the University of Nigeria in the veterinary medicine. Also, who's currently working in the Nigerian Youth Service Corps. It's great to have you here, sir. And my first question towards you is, how did you start about the veterinary medicine? Like, what really moved you to choose this path?
Since when I was very young, I've always loved animals. And then matured into more of a passion. And that passion had to do with looking after animals, trying to know how best to ensure their welfare. And when you see animals, dogs, cats, cute animals such as that, they get ill, it feels almost as if your brother is ill as well. So when you get that feeling, that burning passion in you to try to, heal them from their disease and pain, you know that you want to come into a profession.
What kind of steps you could suggest for us to do something like that on a large scale when you start a club?
There are not a lot of shelters, here in Nigeria. In Nigeria, the system is designed where a lot of owners prefer to keep their own dogs in their houses. And then we have a lot of stray dogs on the street, even though there are a lot of NGOs that, try their best to get these animals off the streets, because not just are they, homeless, they are also they could also serve as a way to transmit some diseases which could be zoonotic in nature as well. But I feel that if you build a shelter or, as a club, find a way to get a shelter that would house a lot of dogs that don't have homes, it's very possible. I think that what you should focus on more is how to get these dogs homes, right? So if you have like a means of reaching out to the public, a website, banners and all of that, you will be able to reach out to people who, may be in places where they want this dog. They might not have direct access to you, but because, they're seeing what you're doing, they would like to contribute by adopting or no, by making donations to your. There are a lot of shelters abroad, especially in the US and the UK. But in Nigeria, we have not been able to achieve as much shelters as I would like, but there are efforts going on to do that. But I think the most important thing is not overburdening yourself so much so that you have so many animals in your care and you're not able to take care of them. So I feel that you should also find a way to reach out to people who may be wanting to take on the dogs or may be wanting to contribute to your efforts.
This part, the veterinary medicine is quite improving, it's evolving. How do you see that it has made an impact right now in the present?
Veterinary medicine is, evolving a lot. In Nigeria, very few people knew about veterinary medicine before now, but the situation is improving because, especially with the advent of COVID-19 and the impact that it had on the world, many people got to see the environment, animals and humans have to work together, have to be healthy, to prevent an extinction event or like an apocalypse. So you have to have a situation where everything is in balance. And then animals are, we need to take care of them because if we do not take care of them, there can be a reason why we could go extinct. So veterinary medicine is evolving a lot, especially in the area where I am in companion medicine. You start seeing things like prosthetics, advanced surgery, imaging technology that has never been seen before. See cancer research, more methods to try, to alleviate the pain of animals, especially even in the areas of food formulation. You see a lot of research going into that and how to improve their feeding to make them healthier. So a lot is going on all around the world, and I'm proud to see all of that happening.
People who are starting with this field, what would you really suggest them? Do they just think about the love or do they just think about the service that they're going to do? Like, what do you say to such people who are just starting with this?
when I started, it was just to love, just to love, just to see them well. But a lot of people find themselves in veterinary medicine, and later on they might feel like, oh, maybe this is not what I wanted to do after all. But still, it's not just about being a doctor and being able to use a scalpel or being able to diagnose diseases in animals. It's more of looking for their long-term welfare. Yeah, their long-term welfare is what's important. So even if you look at it as service, along the line, most people get to fall in love with these animals. Can't imagine, sitting with these animals, feeling the pain, having empathy for them, and not getting to love them. I think that most people will get to love these animals if they get to know them. So you might start initially as seeing it as service to them, but along the line, I think you get to understand why we need to do our jobs well, and you get to love them along the line.
Is there any fast experiences that you have gone through while dealing with animals or while saving them?
Yes, I've had a lot of experiences. Let me start with a sad one I had recently. Well, I'm not going to be mentioning names for ethical purposes, for ethical reasons, but there was this client of ours in the veterinary clinic where I work, and she had a dog, a Lhasa Apso, who was still a puppy, about 8 months, and the dog contacted parvovirus. Unfortunately, then we started treatment. The form of parvovirus she had was just too much for her to take. So at the end of the day, she had to be euthanized because her condition had gotten so bad. When we had to break the news to her that her dog wasn't going to make it, almost everyone in the clinic was crying as well. It was such an emotional experience, and when you're in such a situation where there's nothing more that you can do, it's hard. It's really hard. You feel how hard it is for the owner, for the client. You feel how hard it is for yourself, and you feel so sorry for little dog or cat or fur baby. But I've had some very good experiences where animals are able to recover. There's this dog that we got to adopt at the clinic. She was going through a vaginal prolapse. She was losing so much blood. And whenever she comes into ovulation and heat, she gets a vaginal prolapse and she starts losing blood. So we had to do a transfusion, and then after the transfusion, we had to manage the condition, and she was able to recover. And at the end of the day, because she was a stray, we adopted her at the clinic, and she's been a joy to watch since then. Things like that make me very happy.
Like, are you a student right now?
So I'm not a student. I graduated last year
Okay.
from the
Yeah.
University of Nigeria, and right now I'm in here.
Yes, I'm very sorry about that. How do you describe the demands and the workload while studying veterinary medicine? Like, what kind of demands you had and the struggles or whatever?
The demands have been massive. The way we work, you have to have that mindset, to be very hardworking. Unlike a lot of other courses that get a lot of spare time. For a vet, even in your spare time, you have to keep reading, keep watching videos to help you improve your skills so that you can deliver your call, and not just the existing pool of information. A lot of new things are coming as well, so you have to keep up to date with all of the recent research and all of that. So it's not easy being a student as well. Have a lot most of the time. Your instructors are not able to cover the whole syllabus or the whole scheme, so you have to go a long way also on your own to try and meet up. And then you have friends in other disciplines, other faculties, other colleges, and you cannot relate to them on their level because you have to meet up to the expectations of very serious discipline that you're in.
What kind of hands-on experience did you have during your program? Like, you should have experienced a lot of things, right? Like, people would come with their pets hurrying up, like asking you to do something with a surgery or sort of medical necessities, right? How do you handle with that? And what sort of hands-on experience did you have during your program?
I think veterinary medicine is a place where you just have to take initiative. It's something where you just have to dive in. stop doubting yourself. For a long while, I doubted what I could do because I was reading a lot and I had a lot of the knowledge from what lecturers, our professors had been teaching us, but I wasn't sure whether I could do it practically. To date, I have done a number of surgeries, I have done a spay, I've assisted in a cesarean section of dystocia, and a lot of other things that we have done. Interpretation of a lot of symptoms to get the right diagnosis. You get scared, you don't make a mistake. But at the end of the day, you find out that when you apply logic, you would most likely get the right answer. And with the experience of those who came before, it gets easier. In school, part of the program in Nigeria here, you get 1 year of clinical student practice where you get exposed to large animals, small animals, birds, zoo animals, and all of that, and how to treat them. There's a lot of experience to be gained, but you just have to take initiative. And in my case, I found out that the more I practice, the more I learn. So I have experienced quite a number of things.
Like, on what point of your life did you choose, I wanted to go to this part of in the profession? The question comes there, like, is it the love and the service? He's my friend. I think he's 12 or 13. Today, when I go and ask him, like, what are you going to become? Without even a pause, he says, I want to become a veterinary doctor. So he takes care of his pets so much. He has a lot of pets in his house. And whenever I go and ask him, this is the thing he first mentions. So it literally says the kind of love towards his pets. Like, on what point of your life you chose veterinary? You keep switching professions, right? On what point of your life did you choose that?
It was later on in my life, I think when I was 16 to 17, just finished secondary school, But when I got to school, a curriculum, sort of a book that contains all of the courses offered in particular universities. And then I stumbled upon veterinary medicine in that book. And I realized that, wow, I had didn't know about this course so much before, but I had always loved animals. I always had the passion to take care of animals, and this is my chance to do that. I didn't know that I could do this before, but now I know that I can do this. There were quite a number of people in my program that didn't really want to be there. They just chose the course. But I was sure that this is what I wanted to do because I felt like I had the capacity to grow in this program, give all I could to, at the end of the day, qualify to offer animals the best treatment possible, the best welfare possible, advise owners on how to take care of them. And the more that I learned about them, the more I fell in love with the course. And at the time that I came out, I found that this is really what I wanted to do because I was treating them and I wasn't tired. I was working and I didn't want to stop. I think it just grew along the way, the love and the dignity of the service. So I think people feel it in different ways. There's some people who love animals, but they cannot keep up with the stress and the demands in veterinary medicine, but they love animals. But so I think that you just have to have the heart to serve and love them as well. And that's how it was for me.
Can you share the memorable and challenging experiences you've had during your part of the program?
Vet school is quite rigorous. It's difficult for a lot of people. So sometimes you lose some of your classmates along the way because some of them are not able to continue with the program. And some of them find out that it's not really what they want. Almost 150 that were admitted into the program. By the time we were graduating, we're just about 40 of our original who came in that were graduating together. So that means that more than 100 people not continue with the program for one reason or the other. So it was challenging to see a lot of people go, some people even in the fourth year of the program. So it was heartbreaking for a lot of them. I had to learn a lot of new things. Sometimes the training was difficult because you had to stay up late nights, wouldn't get a lot of sleep, and you just had to sacrifice a lot to be able to finish. It's worth it at the end of the day if you're able to finish the program.
After all these experiences during your hard times, what was your driving force? How did you move forward in all those situations?
I had to succeed. Always had the sort of mentality that anything that I started, I could finish. You look at a lot of people and they've been able to achieve what they've been able to achieve, not because they're the best in their field, but because they gave everything to achieve it. So if it meant that I wasn't gonna sleep, then I wouldn't sleep. If it meant that I wasn't gonna do the things I wanted to do, you just have to be able to sacrifice to succeed. I think that's just the general principle in life. Doesn't matter whether you're studying veterinary medicine or any other thing. You might be a footballer. You just have to give all it takes to get to where you want to go.
That was such a great answer. So thank you.
How did you balance your academic responsibilities and other aspects of life during your part of the program? How did you balance both of it? Do you have any commitments and how did you balance about it?
So you just have to know what you can carry. A lot of people were interested in sports as well. I used to play football when I was in school. It's an individual choice. Some people didn't participate in anything else. They just wanted to do veterinary medicine and leave school. I wanted to do other things as well. Right now, I attend Red Cross programs. I find it fulfilling and something that I really want to do. Depends on what you want to do. You can try as much as possible to participate. You may not have all the time to participate, but at least you can contribute your quota. Make sure that presence is felt wherever you want your presence to be felt.
I am quite inspired by your story and all those things that you just told right now. And this meeting was quite useful for me because I myself, it was quite difficult for me around animals, around pets. It was quite difficult because I'm scared of pets. But I think, according to your point of view, when I see it, I suppose I can encourage myself to go through it, go through all my fears and move forward. Thank you so much for this speech, sir, for this meeting.
I'm glad. I'm just glad I was able to share my experience with you and Twitter. It's something that you can be joyful about when you go through it and look at the people, the future generation, and tell them that journey is worth it and you can do it and that you got all that it takes. So I think that you've got all that it takes.
What did you find really fascinating about the veterinary field?
Before I started reading veterinary medicine, I used to think that animals are very, very different from humans. Here in Nigeria, I think people rate human medicine very highly. A lot of people want to become medical doctors for humans, and not as much people want to become veterinary doctors. In my second year, we were doing a lot of veterinary physiology, and I realized that veterinary physiology was very similar to human physiology. The anatomy was different. The functioning was similar processes in their systems. There were quite a lot of variations you can compare within species. When you really look at it holistically, you find out that it's very similar. Human doctors and veterinary doctors can work alike. They can understand each other. Almost similar drugs are used to treat both humans, and animals. They have almost the same effects at the end of the day. So I was very, very fascinated to learn that.
Is there any specific areas of veterinary medicine that you were particularly so interested about?
Under public health, especially in my school, where I schooled, divided into epidemiology, biostatistics, meat and milk, and fish hygiene. But I was very interested in the whole of public health because it gave me an insight to some of the problems that the world was facing, especially at that period when I was in school with COVID-19, the Ebola virus, a lot of other things like that. It made me realize that the danger that they held, and not just for animals, but for humans and the environment. Also enjoyed physiology because, like I was saying earlier, it made me get very interested and realize that a lot of what we were doing was similar to what human doctors in the hospitals were doing as well. It just brought that sense of belonging to the medical community for me.
So how does your university support in terms of resources and the career guidances or any mentorship?
For students, support one-on-one mentorship between students and lecturers and professors. They are very free. A lot of them are very friendly. allow you to glean from their experience, allow you to relate with them one-on-one, ask questions outside of the classroom, forums, or their fora for you to interact with them. In the final year, we focus on clinical practice. So you get to work with them, specialists in obstetrics, surgery, gynecology, those in the laboratories. You work with them hand in hand and see active cases of animals that are brought to the university's veterinary clinic, ask questions as well. Also, in your final year, you get to work with a supervisor, 2 or 3 supervisors assigned to you, but get to learn a lot from staff of the faculty who have had a lot of experience in the field in academics as well.
Students who have interest in this field, but they just don't know where to go and they are puzzled. What are the steps do they have to take, or what should they learn? So, is there any suggestions that you can give?
Globalization has made everything very easy. We are talking to each other just like we're in one room. There are a lot of online courses right now. Maybe you're applying to colleges to study, or maybe you applying for funding. You could take a lot of online courses on Coursera, Udemy. There are a lot of government databases where they offer free courses where you can learn about veterinary medicine and see whether you're very interested. So you could take introductory courses online about veterinary medicine, veterinary surgery, veterinary nursing, veterinary technology, like that. So that could expose you to some of the things that you're going to be meeting if you go to college.
How do you see the future of veterinary medicine? How do you see it evolving? Can you see any hope with that as a future veterinarian? And how do you think you can impact through that?
Veterinarians, medical doctors, and environmentalists work hand in hand to make a better world, acting in support of sustainable development goals. Well, right now I'm a development knowledge facilitator for the Sustainable Development Goals of the United Nations. At least there's 17 goals now, maybe more are going to come up in the future. One that's very important is health. If you're not alive, you're not able to do any of the other things. And veterinary medicine has a very huge role to play in that, because if you take rabies, for instance, rabies is a very big killer. Rabies vaccine is not being developed. Rabies vaccine is not being administered by veterinarians. You have more animals on the streets. There's a research I read where it was said that up to 60% of the diseases that affect humans actually come from animals. So you can see how important it is to have veterinarians in practice, in research, in academics, public health. Veterinarians have to work hand in hand with the rest of the people to ensure that the world is safer for us all. How much antimicrobial resistance, how much impact is having on the whole of the world. Veterinary medicines are one of the great stakeholders to ensure that antibiotics are administered ethically and responsibly, so that the problem of antimicrobial resistance doesn't spiral out of control. We find the world is in a big mess because of that.
Yeah.
So we have a very huge role to play.
The final question is, do you have any advice to the secondary school students just about to get into this veterinary field?
Be prepared. It's not going to be easy.
Thank you so much for joining with us today. It was just amazing interacting with you alongside my friend. Thank you so much for this opportunity, and just shared a lot of things that we don't know. Being from the tech background, we just know a bit about tech, but not about the veterinary. But you gave a lot of insights about it. This is amazing talking with you, interacting with you. Thank you so much for your time, sir.
Thank you so much, sir.
Very nice meeting with you. I also inspired to do more. A lot more people come into veterinary medicine and know what it's about. Get encouraged that they're making an impact on the world and they're leaving a legacy. Save a lot of people in time to come.
Thank you so much. Thank you so much for your time, sir.
It's my pleasure. My pleasure. Thank you.
Pleasure as well, sir. Thank you.